This is my presentation on increased intracranial pressure in children. What is increased intracranial pressure? Increased intracranial pressure is the amount of pressure exerted in the brain. Increased intracranial pressure is a result of the body's autoregulation not working properly. This causes the pressure sustained at 20 or higher for over 5 minutes. The brain can swell for multiple reasons, such as infection, trauma, hypoxia, and other diseases. Overproduction of fluid and communication errors in the neurological pathways can also cause problems. What population is at risk for increased intracranial pressure? Increased ICP can affect anyone at any age. The main population that it affects is people with one of these disorders: too much cerebral spinal fluid, bleeding into the brain, swelling in the brain, aneurysms, blood pooling in some part of the brain or head injury, brain tumors, infections such as encephalitis or meningitis, hydrocephalus, high blood pressure, and stroke. Children born with hydrocephalus are at a higher risk to gain this disorder, and adults who perform in high-risk taking activities are at higher risk for gaining increased ICP. Signs of increased intracranial pressure. For infants, it could be poor feeding or vomiting, irritability, restlessness, lethargy, high-pitched crying, increased head circumference, separation of cranial sutures, distended scalp veins, setting sun sign, which is the eyes deviating downward, or hard fontanelles. For children and adolescents, it could be headaches, diplopia, mood swings, slurred speech, papilledemia, altered level of consciousness, nausea and vomiting, especially in the morning, and changes in motor function such as decorticate, decerebrate, and flexion. The prognosis of ICP. Long-term effects of increased ICP is seizures, strokes, neurological damage, and death. The prognosis depends on the underlying etiology and severity of the presentation. Benign intracranial pressure does not increase the risk of death rate by itself. Rather, the death rate is increased by morbid obesity, which is a common association with benign intracranial hypertension. Visual loss is a significant morbidity in increased intracranial pressure. Due to the child's prognosis of increased ICP, they may need physical, occupational, or speech therapy. Nursing implications. You would like to teach the parents important signs and symptoms to monitor related to their child's condition, side effects of medication, and when to call the physician or nurse, and provide written instructions. Assist with anxiety reduction techniques such as relaxation techniques, which can be listening to music and guided imagery. Keep the parents informed of the child's progress, prognosis, and plan of care. Encourage parents to talk about concerns and ask questions. Allow parents to make decisions when possible. We would also like to allow time for family education if the child is to undergo surgery, provide preoperative teaching for the child and parents. Medical treatment for increased intracranial pressure. Some tests include urine electrolytes, EBGs, CBCs, EEGs, Glasgow Coma Scale, and radiography. To read the ICP, they may need to use an intraventricular catheter or a subarachnoid bolt. The diagnostic tests for increased ICP include CT scans, MRIs, lumbar punctures, and a serum and electrolyte level. Management of increased ICP has multiple steps and starts with figuring out the cause first and fixing that. While they figure that out, the treatment is therapeutic. The main goal is to reduce the volume of CSF with an osmotic diuretic and to preserve cerebral metabolic function by monitoring blood glucose, and to avoid any increase in ICP by watching diagnostics. The therapeutic management is to have the patient's bed at 30 degrees with the patient midline in bed with the head and neck in a midline position. The patient should be given an osmotic diuretic or a hypertonic saline. The patient should be non-thermal and be maintained to keep the patient's temperature in order. Blood glucose should be closely monitored, and intravenous fluid should be given for patients that are hypovolemic. Ventilation is used if there is any sign of cerebral herniation. New medical treatment, optic nerve sheath diameter, present and future perspectives for neurologists and critical care physicians. This method of recording ICP measurements is a non-invasive and is cheaper than other imaging. The standard form of measuring ICP is invasive and can lead to many different forms of infection and complications. This new form of monitoring can reduce the chances of complications and can be done at the bedside, which avoids transporting critical patients. This method is done by putting gel on the eye and measuring the ocular nerve diameter. The article stated, because this bedside tool allows for fast and safe real-time assessment of conditions associated with elevated intracranial pressure, octave nerve sheath diameter measurements together with invasive ICP monitoring is a valuable tool for neurologic conditions with clinically suspected variations of ICP. With this new approach of measuring ICP, we may have a solution to decrease the number of infections due to invasive monitoring. New medical treatment, monitoring, and measurement of intracranial pressure in pediatric head trauma. Finding the correct ICP range to keep children and infants is important since keeping it within range can prevent further damage. The normal range for adults is 5 to 15, but we do not know if this is the normal range in children. What we do know is that ICP changes when we move. Therefore, learning the accurate range is vital to help with treatment. With finding the range, we can help reduce the chance of morbidity. Since the evidence was lacking, I found a study where they did find some results. Within the ICP monitoring group, the children with the Glasgow Coma Scale score of 3 to 5 had a higher mean ICP than those with the Glasgow Coma score of 6 to 8. The need for further cranial surgery was also higher in children with higher openings than in children with lower openings and ICP pressure. Although we did not find an accurate range, the medical community found a range that helps reduce morbidity. Increased intracranial pressure in infants and how it affects them. Increased ICP is more dangerous in infants since they have a higher risk for death. Infants' brains are still developing, so it can delay or damage any development. Developing neurological pathways may be at more risk than those that have already been established since they have not fully matured to protect themselves. This can also cause a delay since increased ICP can lead to defects with hearing and eyesight. This affects infants since the damage to their brain can delay them from accomplishing the developmental tasks when they are supposed to be accomplished, since their brain is more focused on healing. Important tasks such as Erikson's trust versus mistrust, Piaget's sensory motor stage, and Kohlberg's nativity and egocentrism stage. Increased intracranial pressure in toddlers and how it affects them. Toddlers and increased ICP can cause a conflict. Toddlers are still in Piaget's preoperational thought stage and believe that illness is a magical being. Toddlers may assume that the headache is caused by a magical creature causing damage in their head. Toddlers are in Erikson's stage of autonomy versus shame and doubt. In this stage, they are trying to develop a sense of control over themselves, their body, and their surroundings. The toddler is trying to gain a sense of control and will try and exert themselves on others. With increased ICP, they will not feel control since they cannot change what is going on with themselves. This may change which stage they go through and have them go into Erikson's stage of shame and doubt instead of the side of autonomy. Increased intracranial pressure in preschoolers and how it affects them. Increased ICP in preschoolers would have a great effect in preschoolers. Preschoolers are still in Piaget's preoperational stage, so they think that the illnesses are magical beings to punish them for doing something bad. They are also in Erikson's stage of initiative versus guilt, and they are characterized by purpose. They think that they can do things by themselves, and being in the hospital can greatly decrease their chance of doing those things. Many preschoolers tend to regress in the hospital, so it'll take them longer to develop through this stage. One thing that we can do, though, is we can still give them the chance to do things for themselves, even if it's doing something such as picking out their own clothes in the hospital. Increased intracranial pressure in school-age kids and how it affects them. Increased ICP in school-age kids may be hard to grasp since their thinking is just now moving from Piaget's stage of preoperational to now being concrete. The school-age kid is in Erikson's stage of industry versus inferiority. While the child is in the hospital or recovery, it can affect them since they will have to stay in one place to avoid risking the ICP going back up. While they're in the hospital, they may feel as if they're in the inferiority stage, since they are unable to hone skills or learn how to talk and connect to peers. Increased intracranial pressure in adolescents and how it affects them. Increased intracranial pressure would affect adolescents much differently from their younger peers. Adolescents may assume that they dealing with something such as increased ICP, they may lose friendships, since camaraderie is a very important thing in an adolescent's life. The adolescent may be very withdrawn and not interested in what is going on, since this is ruining their social life. They are finally figuring out who they are in the world. In the Erikson stage, they are in identity versus role confusion. In this stage, they are seeking independence while they are in the hospital or in recovery. They cannot find out who they are in the world. One thing we can do is also have friends or comrades come to the hospital or recovery to visit them so that they can still maintain these friendships. How does increased ICP differ in children and adults? Increased ICP differs between adults and children based on how their brain reacts to it and the causes. The treatment course is the same. Children's brains are more vulnerable than adults when it comes to damage caused by the pressure. Children that have experienced increased ICP may experience different effects such as visual changes, memory difficulties, hearing loss and changes, and mood differences. Teach the parent to be calm and understanding with the child. As an adult, they may need therapy from brain damage. They may also have headaches, personality changes, confusion, and blurred vision. As an adult, they will have to adapt to the changes. The teaching between the two may be different since the adult's and child's life is completely different. We need to adapt our teaching to the different lifestyles. The adult may have to continue with physical therapy, speech therapy, and occupational therapy. The Glasgow Coma Scale may be different since an infant will have a different verbal response than an adult, and there may be delayed growth and development in the child. Complications as an adult from increased ICP. As you can see, there's many different complications, but if the adult has any of these or isn't experiencing any of these symptoms, they may need OT, PT, speech therapy, and/or cognitive therapy. The adult may also need medications to decrease swelling and other occurring problems. They may also need medications to help them deal with these complications, but it is important to remember to be patient with them and give emotional support. Here are my Nclex questions. If you want to pause this and read them, I will provide the answers on the other slide. The answer to question 1 is B. One of the main first signs in increased ICP is mood changes. This is the first indicator before more serious symptoms occur. The rest of the answers dismiss the personality change and the parent's concern for her child. Answer to question 2 is also B. The main thing that you would do is complete a full neurological assessment and call the PCP with all of your assessment findings and information. If their pupils are off, there may be other neurological problems. A and C are correct, but you are forgetting a complete neurological assessment, and D is wrong since you never leave a patient without doing an initial assessment first. Here are my references, and thank you for listening to me.